loves dark chocolate!
Oh my God.
Like if you could show me, let's start with the top one maybe and slowly like lift up and move close to the camera.
So get really close to
Oh, okay, those are his two nostrils right there, right?
Yes.
Okay, I see now. All right, and then on his left nostril, wait, do you mind holding that up again a little longer? Is that okay or is that uncomfortable?
Live that way.
There you go.
Now, as that one is lifted, can you lift the other one so I can see, so you separate, yes. Okay, okay.
Poor guy. So this appears to be a very extreme example of Rhinophyma, the most extreme example I think I've ever seen. Rhinophyma is excessive growth of the sebaceous glands of the nose, and it is related to rosacea. Rosacea is a skin condition that so many Americans have where they get redness and flushing of the skin. Well, when it gets to an extreme case, you can actually get growth of these sebaceous glands of the nose, and the nose can enlarge. And I tell you, as a surgeon, oh my gosh, how satisfying would it be just to lop those babies off this poor guy's nose? So satisfying.
Big lips check.
What is she? What are you doing? It's like a vacuum effect on her lips. She's doing this Kylie Jenner lip challenge with some little plastic container. Oh my gosh. She's like a walrus. Oh my gosh. A couple years ago, there was the Kylie Jenner lip challenge that was all over social media, where young women would attach various suction cup devices to their lips to suck them larger to look temporarily like Kylie Jenner. But the good thing for her is that this will come down, it should go away. It may leave her with some bruising, maybe some broken capillaries, but thank God it's not going to stay like this.
Hey, I wanted to share my story, so here it goes. I've battled with eczema since I was a kid, on and off throughout the years, and to treat it, dermatologists always prescribe me topical steroids and immunosuppressants like ointments and creams to apply onto my skin. Until last year, the steroids weren't working anymore. I had heard of people curing their skin issues through natural and holistic methods, and I was tired of not only the steroids, but the lotions and moisturizers that controlled my life. So on September 22nd, 2019, I quit using all the steroids, and the very next day, I began experiencing topical steroid withdrawal, aka TSW. My skin had become reliant, addicted to the steroids that were suppressing my immune system for so long, and now it had no idea how to function without them. That's how my story begins.
Wow, what a touching story. This young man has been treated with steroids for so long, and steroids can be very, very helpful when you're in an acute situation. Like if you get poison ivy or some of these other types of flare-ups, it can be very effective to help reduce symptoms. But this is the issue that I have with a lot of traditional medicine, is that we're not getting to the root cause of why somebody, let's say, like this young man, has got these skin issues. We're just giving him medications to suppress the body's immune response. So in his situation, I would strongly encourage him to see a functional medicine physician in addition to going back to seeing a dermatologist.
Right, left, drip, splash, splash.
Oh my gosh, are you serious? There are all of these videos circling around TikTok, like this one, where somebody has, let's say, acne scarring, and they apply some type of a cream to their skin, and they wipe off the scars. It looks like they're wiping off like chia seeds, and it's so obviously photoshopped afterwards. It's crazy. Oh my God. Are these muscles real? No, these are muscles that have been created by injection of an oil called synthol. This is a very dangerous thing that some people are doing. Injecting oil into your muscles is not going to make your muscles any stronger. Just because the muscle is bigger because it's been injected with all this oil, if anything, it might actually be weaker. So if you just show a picture of this guy and a picture of me without my shirt on and say, who's stronger? Almost everybody would say that that guy with those massive muscles is going to be stronger than I am. In reality, that may not be true because his real muscle mass could be potentially smaller than my puny muscles. So what's happened to this guy is he had some type of an injury to his neck, and he required reconstruction of his neck and the upper part of his chest. So what they ended up doing is the plastic surgeons took his latissimus muscle, which is a muscle on your back, along with the overlying skin, and moved it to basically recreate his neck and the upper chest. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Let's talk about things no one tells you before getting breast implants. After surgery, you'll be given this little card. It's the serial number to your new titties in case they ever get recalled or they have to be used to identify your dead body. After surgery, you can't shower for 48 hours, and the first time you see your new tits will be horrifying because they look awful, and I mean awful.
I warn my patients about that.
The physician will tell you that it will feel like the implants are really high on your chest. It takes new implants approximately 3 to 6 months to drop and fluff. So until then, you're stuck with some weird ass titties.
All of these things, as she said, are things that I tell my patients. I just don't call them T-I-T-T-I-E-S. Although a doctor I used to work with used to say that all the time. And it would just make me feel so creepy when he would say that. But it is true. If you have breast implants and they're placed underneath the chest muscle, the pectoralis muscle, the muscle swells and it kind of sucks the implants up with it. And yes, it can take upwards of 3 to 6 months sometimes for all of that to settle.
You good in there?
No.
Jeez.
So if any of you are lactose intolerant, you know what that feels like. I tell you, I'm lactose intolerant. And the last time I had a Wendy's Frosty, that was me. So I haven't had a Wendy's Frosty in like 20 years. Oh my gosh, you're so cute. If you follow me on social media, you know just how much I love my rescue dogs. And on one of my last TikTok videos, I showed all 3 of them. Unfortunately, recently, our oldest dog, Sammy, otherwise known as Num Nums, recently died. And it absolutely broke my heart. And I'm still grieving for him. I think it's been now, it's been almost a month now, and I just miss his sweet little face. So I love seeing videos like this because there are so many animals, cats and dogs and even the other animals, that just need somebody to save their life, to give them a home. There is nothing better than the feeling of saving a life. So we've watched some funny and kind of crazy TikToks so far. Let's watch a few of mine. So you watch this video, I gotta ask you, do you think the poo was real? And if you don't think it's real, what did I make it out of? How do you know if your itchy butt is due to pinworms? These are tiny worms that live in your intestine during the day, but creep out of your butthole at night and lay eggs. These eggs can cause severe itching around your butthole and is one of the main signs of a pinworm infestation. You can test for eggs by applying Scotch tape around your anus in the morning, bringing that tape to a lab, and looking for eggs under the microscope. If you've got pinworms, whatever you do, don't scratch your butt and then bite your nails because you can start that whole infection process all over again. All of this is true. Pinworms are real. They actually will crawl out of your anus at night and lay eggs around it. And the way to diagnose it is literally the Scotch tape test. So be very careful. If you've got an itchy bottom like that doesn't seem to go away, see your doctor. Large caramel latte. What is the name on that? Dr. Anthony Youn, MD. All right, Anthony. No, Dr. Anthony Youn, MD. Okay, Dr. Anthony Youn, MD. Large caramel latte for Dranthony Younumd. Table for 2 for Dr. Anthony Youn, MD. Okay, Dr. Anthony Youn, MD. Yeah, I'm not like some DDS or something. Here, take my 2 coats. I'm here to get my car fixed. I'm Dr. Anthony Youn, MD. Ooh, rich doctor, huh? Well, I guess so. Well, in that case, I'll charge it double. No, I don't act this way, but there are so many doctors who do, and they think that just because they're a physician that they're entitled to special treatment, when it's just not true. If you want to watch me react to more insane and hilarious TikTok videos, take a peek at this video right up here, where I react to some that will absolutely blow your mind. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.